suggests too much sleep is bad for your health. A study published in the Journal of the American Heart Association found that people who sleep 10 hours a night, who are those people, were 30% more likely to die prematurely than those who slept for 8 hours. The risk for death from stroke and cardiovascular disease also increased. The paper looked at 74 studies involving 3.3 million people, so that seems like a big study. Our Dr. Narula is a cardiologist at New York's Lenox Hill Hospital. That's part of the Northwell Health Organization. I never think of you, Dr. Tara, as a liar, pants on fire. I can't wrap my brain around getting too much sleep is bad for you.
Yes, in the words of Shakespeare, there may be too much of a good thing. So in this study, it's really unclear what the mechanism is. But how could it be? So the question is it the sleep itself that's creating the increased risk? Or is it that people who sleep longer have underlying problems, medical conditions that are making them at risk, and they're sleeping longer because of their underlying conditions? So what types of underlying conditions? If they have anemia, some sort of chronic inflammatory disorder, depression, if they have sleep apnea, those are going to increase their risk. It's also going to potentially make them sleep longer. Could it be that the biology changes with changes in the circadian rhythm by sleeping longer, and that's causing increased inflammation, weakening of their immune system? Could it be that they have other adverse health behaviors? So people who sleep longer, maybe they don't exercise as much. And last but not least, could it be completely unrelated and have to do more with unemployment or socioeconomic status, and that may be factoring in? So a lot of questions still that we need to answer, but certainly this was a very big study. And this is what they found, increased risk.
What does it mean for people who try to catch up on sleep on the weekends, and especially with people who maybe get 5 or 6 hours? I'm just curious. A friend asked me to ask you.
Hello, my name is Gayle, yes.
People who don't have kids who try to catch up on the weekend.
Exactly.
Yes. So the research would suggest that this is meant for people who are really sleeping 9 or 10 hours consistently, every single day for long periods of time, not just people who sleep low amounts during the week and then try to catch up on the weekend. But really what you need to remember is consistent and regular sleep health patterns are important. So a sleep hygiene regimen where you're going to bed and waking up at the same time, where you have a cool, quiet, dark room, putting your devices away, you're not drinking caffeine or alcohol right before bed, and you're exercising on a daily basis. All of this helps.
So why should doctors then ask their patients about their sleep patterns? How important is that for a doctor to know?
It's really important. In fact, the American Heart Association put out a statement in 2016 saying that irregular sleep increases risk, and we need to ask about both duration of sleep and quality of sleep. And if we find that there's some irregularity, we need to screen people for increased cardiovascular risk, for risk factors, and potentially send them for sleep studies if we think they have sleep apnea.
Yeah, years ago, doctors never asked, and now lately,
we ask.
Yeah, now doctors are asking.
We're learning about more of these, quote, non-traditional risk factors and how important they are, things like stress and your pregnancy history in terms of raising your cardiovascular risk. So just to remember, ages 18 to 64, regular sleep 7 to 9 hours is recommended. Greater
7 to 9 is a
65,
sweet
7
spot.
to 8. Yep, 7
We'll
to 9.
try.
Tara,
Try.
Thank you.
Thank you.
Still sleeping on the weekends. Thanks.
And over 54, what happens to those jamokes?
Over 54?
Yeah.
Well, they're still within that 18 to 64.
Oh, I thought you said 54.
No. Over 65, 7 to 8 hours.
Okay.
Good term.
We're good.
Yes, we are good.